Good day. We come now to the last part of Quarter 2 in health. As you remembered, it all started in courting, then dating, then engagement to marriage to prenatal, the pregnancy and labor to postnatal, the immunization and now being responsible parent and family planning. Let us start. To satisfy the need for attaining adult status and social identity, a man and a woman decides to be a parents. Parenthood is the state of being a parent. This is when you and your partner have a child. Having a child gives parent a feeling of achievement and competence, power, social comparison, and economic utility. As you become a parent, your responsibility changes. You will have a lot sacrifices to consider as becoming a parent to a child. As mentioned, being a parent will add a lot of responsibility, not just for a child but also for the family. Responsible parenthood is the will and ability to respond to the needs and aspirations of the whole family. Parenting is a great responsibility and a demanding job that many parents are not truly prepared when they enter into it. Regardless of couples' lifestyles, the preparation to become a parent involves proper planning. Parents are expected to perform these duties and responsibilities. Together with teachers in school, parents, which is the first actual teacher of child, should provide the necessary education for a child for at least the basic of primary education. Whether it is in private or public school, parents are expected to provide the needs of a child in education. Parents must help their children develop their potentials. Parents must have time to teach their children aside from sending them to school. Another duties and responsibility of parents are spiritual formation, training children to become responsible and inculcating discipline. Everyone has the right to choose their own beliefs and religion, but a child doesn't have an idea of who is God, and it's the parents' responsibility to introduce God to their children. In disciplining, it should start early by clearly defining set of rules. Must not tolerate mistakes. Teach children to apologize. In training children to become responsible is simply giving tasks to children what to do and giving more tasks as they grow. It will definitely teach them to become responsible when they grow. Provision of care, guidance and love. Taking good care during sickness. Activities of children must be guided and supervised by parents. Loving and caring for children is a full-time responsibility of parents. Providing experience to develop social competence. Parents must provide children opportunity to develop self-esteem, independence, self-confidence, and interpersonal skills. Training children to be a good member of society. Develop the characters of their children to become more mindful on their responsibilities, rights, and roles in the society. Picking up trash and putting them in proper trash bin. Having a worthwhile activities like fun run, Zumba, and sports and practice sportsmanship. Joining community cleanup drive. Being responsible parent, you need to consider the family size or the number of persons in the family. Number 1 is the nutritional status of the family. Is the family, or the parent can provide the basic needs such as food based on the family income. Another effects of family size on health is the morbidity. This is when one member of the family got sick. Can you handle the expenses? Is the house has a room for recovery or quarantine for those who got contagious disease? For risk behavior, it means that risk is high for a very large family to have drug addiction, especially if one member of the family is into it. Can the parents look or handle this case if they have a lot of children? For the utilization of health services, though some government offers free hospitalization, but medicines are not free. Nowadays, we have lack or few of doctors and nurses or health care workers for every patient in the country, and not only that, the facilities as well. If there is no family planning, there will be a rapid growth of population, and most people in the Philippines, especially those who have a big family size, are in marginalized sectors. Then it will definitely result to malnutrition. This is a growing population with disparities in distribution can add strain to the environment to feed people. Aging population is a different matter. This is for the country who has population growth of older people. Like in Japan, most Japanese people are so independent and career-oriented that they tend to have one child or to no child because they grow old and can't bear a child any longer. That is the reason why they have more older age population than younger ones. Because of so much competition in the Philippines for a job and so many job seeker, salary is so small that it is so hard to provide for a growing family. That is why parents try to seek greener pasture in other country, and they tend to get the whole family for a better living and opportunities as well. Now, to control pregnancy or to avoid rapid population growth, family planning is the solution. We have several methods in family planning. We have natural, which is a method of birth control that involves abstention from sexual intercourse during the period of ovulation, which is determined through observation and measurement of bodily signs. Another method is the artificial barrier. This is any unnatural technique used to prevent conception. The tools used are condoms, foams, intrauterine device or IUD. For the chemical method, used of pills for impregnation. For sterilization, this is the complete operation done in hospital to prevent conception. Vasectomy for male genitals and tubal ligation for women. Usually, hospitals or government hospitals offer this for free when a mother have 3 children already. Having this operation does not remove sexual drive for both parents, so they will still enjoy sexual life without worrying of getting pregnant.